Child life specialists, our goal is to try to help minimize the stress and anxiety that the hospital environment places on kids and families. We try to make this a better place to be. Our goal is to try to help kids understand, first of all, what's happening with themselves, with their bodies, and prepare them for anything that they're going to encounter in this world of healthcare. We use a variety of different techniques to do that, but our backgrounds are in child development. So what we do is we gear it down onto a level that kids can understand, and we use dolls, teaching dolls, we use real medical equipment, we use pictures, we use a variety of different resources to be able to do that. Try to help normalize the environment, so we do a lot of play-based types of activities with kids. In the hospital environment, they have so much control and all that taken away from them, but really what kids know best is how to play. That's what their work is. So our job is to try to continue that normal growth and development so they don't fall behind developmentally when they spend a lot of time in the hospital, but then also give them an outlet for their creativity and just the ability to be able to be kids. Within the hospital and in a couple of the outpatient areas, we have play areas, we have playrooms, we have a really cool teen room for our teen population to be able to go to that's kind of got a 1950s theme with a Cadillac couch and a jukebox and a Xbox 360 and all of that. If they're not able to come to the playroom for whatever reason, then we take play activities and things to their rooms of all kinds of toys. We do art activities, we do science experiments, cooking activities. We also do a lot of different kinds of programming, not just for our kids but also for our families. Most of our kids aren't from around here. They come to us from all over the country, sometimes from all over the world for different treatments. So they don't have a built-in support system when they're here. So what we try to do is help families network and build their own community of support. So we do like a family movie night once a month, bingo, we have a carnival once a month, pet therapy that comes a couple of days a week. We have someone that comes once a month and does massages for families, a person that volunteers their time and comes once a month and does haircuts. Some of our families don't have transportation to get to different places to have that kind of thing done. Sometimes it's those simple things that we take for granted that our families don't have the ability to do. And also it's really costly to be able to have all those extra expenses. So as many of those kinds of things that we can do to help out with our families is what we strive to do. Our department essentially runs off of donations. We don't really have a budget to be able to purchase things. So all of the items I use every day in my job are things that I wouldn't have if there wasn't someone out there in the community that was supporting us. And you know, I've been doing child life a really long time. Sometimes I think that we professionally have felt like, offended if people call us the play ladies or the play people. But what I found is that in all my years in doing this, that there are some kids that I've done some really hardcore child life stuff with, prepping them before they go and have these huge, massive surgeries that are going to be physically disfiguring to them. I mean, some real nuts and bolts, coping, distraction, that sort of stuff. And then when I bump into those kids out in the real world, they're not like, hey, you know, this is the child life person that taught me about what was going to happen with my surgery. It's like, oh yeah, I used to, you know, kick her butt in video games. So it's really that normalcy, that play piece is really what is where we build those relationships with kids and allow kids that ability to continue just being kids. And that, I think, is just really powerful.